Let me talk about our schools and quarantining, something that I've talked to a lot of superintendents over the months, and heard a lot of reports from them. As we said last week, one of the main goals of our COVID-19 vaccination plan is to get K through 12 kids back in school. For all parents who want their child back in school and all districts that want to be back in school, we want them to have the ability to do that. School setting, I think most experts believe, is the best place for most of our kids to learn and socialize. There's no question that it also supports developmental and emotional well-being. It's critical that we ensure our students and staff return to school safely. And we believe they can do this now because of a couple reasons. And one is something I'm announcing today. But let's start with what we talked about last week. As part of the next phase in our vaccination plan, adults working in schools where there are children will have the option to receive the vaccine. We don't have a date yet, not a specific date when this will start. And so what we're asking schools to do is to come up with the precise number of people in their schools, the adults, whether it's a custodian, whether it is a teacher, whether it is a cook in the cafeteria, whatever that person does, and they're interfacing with children, we want them to be able to be vaccinated so we can have the opportunity for parents and the opportunity for schools to put kids back in school. Let me also, though, talk about something else. Our schools have been doing a great job implementing measures with consistent masking. Phenomenal job. Distancing, great job. They've been putting up barriers. They're doing all the things that we have asked them to do. So up until today, we have followed the CDC guidelines in regard to quarantining. That's what we have done. We have followed the CDC's guidelines. This has to do with students who are in close contact with another student, who are exposed to that student, a student who tested positive for COVID-19. For example, students are sitting in a classroom the way it usually occurs. Everyone has a mask on, but they're within 6 feet of each other. More crowded than don't have the ability to keep 6 feet apart. The CDC has called for a quarantining of that particular student, the students who were around that student in close contact. But we started hearing a number of months ago from school superintendents who said, look, we're quarantining students, but we don't believe that these students really have been infected. At least we're not seeing signs of that. Now, what we didn't know is we didn't have any tests to back that up. And we didn't have any data to support that. So we decided to try to go get data so that we could make a logical decision. So earlier this year, we pledged to look at the rate of COVID transmissions in our classrooms. We asked researchers at what's called the Ohio Schools COVID-19 Evaluation Team, which consists of the Ohio Colleges of Medicine, Government Resource Center, the Ohio State University, Wright State University, Ohio University, and the Post-Acute Rapid Response Team to help us by conducting an evaluation in our K through 12 schools. Their results support what we have been seeing and hearing anecdotally in our schools, and that is that as long as students in the classroom wear masks, as long as they are mask compliant and do the best they can with socially distance, they do not have an increased risk of catching COVID-19 from a nearby student who may have had it. Let me now go to Dr. Vanderhoff, who's going to give you a little more details about the study, and then we'll talk about what our new recommendation is going to be to our schools. Doctor?
Thank you, Governor. Well, as you noted, our understanding of COVID-19 safety in our schools has been substantially enlarged now by 2 new reports. The first is the one that you referenced, an evaluation of K through 12 students by researchers of the Ohio Schools COVID-19 Evaluation Team. The second is a report from Mississippi that was recently highlighted in a prominent CDC publication of the December 18th edition of MMWR. I'll start with our Ohio data, which involved the testing of 728 children in 7 school districts between November 10th and December 18th. Now, among the students were 524 children who, while in a school classroom, were noted to be in close contact under the current CDC guidelines with someone with COVID-19. The others in the study were either further away in that same classroom or outside that classroom, but in the same grade. And here's what the researchers found. There was no discernible difference in the incidence rate among the exposed students and the students who weren't exposed. The rates for both groups hovered right around 3%. Now, it's important to note that this involved students in classroom settings, not in extracurricular or community or home settings. The Mississippi report I mentioned supports our Ohio data. It shows that the close contacts of children with COVID-19 were more likely to be family members and less likely to be classmates. Importantly, attending school in person or during the 2 weeks before being tested was not associated with an increased likelihood of a positive COVID test. So here's what we believe. As Governor DeWine just said, our schools have been doing a tremendous job of implementing robust safety measures. When they're applied daily across the state, our schools represent the safest place for most of our students. When you couple this with the fact that teachers and other staff will soon be eligible to receive the COVID-19 vaccine, we really believe we have a solid package. Now, we've known for some time that being in school is, as the governor referenced, important for students, for their academic progress, their socialization, their developmental and mental health. Now, we have the data to tell us that school is also the safest place for our students, even in the midst of this COVID-19 pandemic. Governor?
Doctor, thank you very, very much. So today we are changing our guidance. As Doctor said, we continue to learn more. And I know that there's been a great deal of pain and students not being able to do things because they've been quarantined. And I fully understand that, and I'm sorry that that happened. But we had to go follow the CDC guidance. CDC guidance still is that. It's changed a little bit, but still is essentially that. But based on the data we now have, we're changing our guidance and are no longer recommending that students who have been exposed to another COVID positive student quarantine, as long as all students have been wearing masks and the exposure took place in a classroom setting. So that's the limitation on it, but we're lifting that based upon the study Doctor talked about and also the study that we did in the state of Ohio. Schools should continue to quarantine exposed students if masking and distancing protocols have not been followed. Now, I will say that schools have done a phenomenal job and students have done a phenomenal job and teachers have about masking. And that's why we're not seeing the spread directly in our schools and certainly not from our classrooms. This change does not apply to after-school activities, including sports. Ultimately, this will be one more step to keep our kids in the classroom, which we know is where we want them to be. I want to announce today the extension of the curfew. The Ohio Department of Health will be extending the 10 p.m. to 5 a.m. statewide curfew for another 3 weeks until January 23rd. As you can see, our numbers are sort of in a flux. They're not going down, and we've got to see what happens in regard to the holidays and if there's an aftermath in regard to the holidays. And frankly, while these numbers, we're glad they are not going up like that, they're plateaued at a very, very high level. Again, as a reminder, the curfew does not apply to those going to and from work, those who have an emergency, or those who need medical care. Curfew is not intended to stop anyone from getting groceries or going to the pharmacy. Picking up or carrying out or a drive-through meal and ordering for delivery is certainly permitted, but serving food and drink within an establishment must cease at 10 p.m. The extended order will be posted later today at coronavirus.ohio.gov.